Hi, and welcome to Healing Through Science and Soul. I'm Dr. B, and I wanted to give you just a sample of what visceral manipulation is and how that would look in a treatment session. So I've already gone through the evaluation with the patient here, and it has come up that her system is needing a visceral manipulation treatment. And so we're just going to dive in as though I've already done all that pre-work so we can keep this nice and short for you. So we know through lines of tension in her body that her visceral system is the system that's needing attention today. And so from there, I just want to give you an idea of what that looks like. It's very gentle. It's very precise. It is impactful in the way that your visceral system should be moving on its own. So think of like the fact that you breathe without thinking, right? Inhale, exhale all day long without really giving it much thought, unless you're doing an intentional breath. The visceral system, just like many of our systems, all of our systems actually, should have a natural inherent motion or movement cycle. So I always say it's like a swing set cycle. And so those organs should be expanding and retracting, expanding and retracting. And for optimal function, we want to see that at about 7 cycles per minute. If for any reason it's diminished, let's say there's been surgery, there's been a trauma, like a seatbelt trauma, there's been pregnancy, even if there's been weight gain and weight loss, that can really shift things around. Any kind of illness, dysfunction, even disease processes within the digestive system or heart, lungs, all of that can create lines of tension and different stress patterns throughout the system, and it can ultimately minimize how well an organ or many organs are functioning. Everything is connected. So let's say the liver connected to the stomach through the hepatogastro ligament. So if the liver is not up to snuff, let's say, then it could be creating a line of tension pulling on the stomach. And then therefore, maybe even the symptoms that someone is expressing is as a result of the stomach not functioning well, but why is the stomach not functioning well? And in this case, maybe it's the liver that actually doesn't have that natural movement cycle and therefore is pulling on the stomach, not allowing the stomach to do its job. So that's a little bit about visceral. So we're looking at the mobility of the organ. How does it move when I move? You know, so especially if I'm an athlete, right? Or like I'm a mom, I got to pick up my kiddo. But let's say I'm driving in the car and I need to reach behind me and I can't do that. Why? Is it actually my musculoskeletal system that is limiting me, or is the musculoskeletal system stopping early because of what's underneath, which is a vital structure? Our visceral, our vascular, and our neural system are all vital structures. They keep us alive. And so the musculoskeletal system is going to stop early if that means I'm going to pull on something more vital deep down underneath. Okay, so those are all things we have to rule out. We do that through our thorough evaluation. But for today, I just want to give you guys a good sample of what a visceral treatment session would look like. But that's why somebody would want to have that visceral manipulation modality done. Okay, all right, so yep, just hands at the side here. I've already asked permission to touch through the body line here. So I'm just going to rest on the chest. And by just adding a gentle amount of stress into the system, so gentle pressure in, again, I can follow those lines of tension. So I'm going to do that here. So think of it like if you're in bed and you have the covers, they're not quite pulled up. Let's say they're like at your knees and you have a dog or a cat laying on the end of the bed and you want to pull the covers up. And you don't even have to open your eyes. You don't even have to look, but you go to pull the covers and you know that silly dog is right on the end of the bed. And you can tell where the dog is because that line of tension that you feel through the sheet, okay, or through the blanket. And so that's ultimately what I'm doing here is as I give that little bit of tension, I get line of tension that pulls me up saying, oh, the dog's over here. So speaking of liver, we're getting pulled into her liver here. So then I'm going to follow that line of tension through her system. And meanwhile, I've calibrated in at the beginning of the session. If you don't know what that means, please go back to the video that talks about the way this work works, because I do in the sample session, I go through all of that. But I'm having internal dialogue with her system so that I can ensure that I'm on the spot that really needs that attention that's ready to release today. All right, so for her today, I am getting pulled up underneath the liver. I can inhibit the gallbladder. And it does change the line of tension. I'm also going to inhibit the respiratory diaphragm. Those are both directly connected. It doesn't really do much. Okay. I'm also going to come over to the stomach, and that doesn't change anything either. Okay. So we do know we have the gallbladder in play here, at least at some level. Sits right up underneath the liver. And so being able to synchronize those two is really important. So do you mind, you don't have to look at the camera, do you mind just sharing with them, like, how hard is this pressure?
It's very minuscule. It's very minute. It's very gentle. Very gentle.
And what do you feel, if anything?
Energetically, you can sort of sense the energy coming down into the body, into the various places. But as far as physical pressure, there isn't much to feel.
Thank you. Okay, so maybe take a big breath into the belly. That's just going to augment if we get to like a little stuck point for her system. Okay, her body needed to release that. That happens sometimes, not all the time. But that's just an energy shift that occurs. Again, organs are huge for carrying emotions. And so as we work the physical tissue, we are also working the internal factors. So the emotions, the belief systems, the conscious awareness. Okay, so then I'm just going to reassess. I do not get that line of tension up. That's just a quick sample of one technique. In the whole session, we would ensure that she doesn't have anything more. We balance the body and all of that, just to really make sure that when she walks out of here, she's feeling really good. And those lines of tension now have the ability to continue to release over the next couple of days to really ensure function and flow through her system, and give her some home integration to support that as well. So if you have any more questions on visceral manipulation, or you are needing a session, we would love to work with you. We would be honored. Feel free to go to our website where you can directly schedule from there. Thanks for being here, you guys.